Okay, we will always need outreach, and outreach will not be handed over to the government. It's not something that government health service will really take on. So that we will need to still continue through INF. Now, our outreach began with these two, Dil Kumari and Kripa. And when we first started the fistula program, we were just running camps. So we had a camp for 2 or 3 weeks of the year. And the rest of the time, we had programs, and these two traveled all over the country. Well, not all over the country, all over half the country. So that by the time the Fistula Centre opened in 2018, they had given fistula orientation in every district of the 3 Western regions to one health member invited from each health institution in the district. So it had been a huge program. It took from 2010 to 2017 to complete, and they did it. Fantastic. They were mostly targeting working with health workers. And then next slide. Next, this is Dil Kumari right at the beginning. So she was the only one at the beginning. And in that first year, 2010, she covered 8 districts, basically with her baby tucked under her arm. Taking the training out to people. And from that first year of outreach, we got 76 contacts, and 56 of those patients had surgery in the big camp in 2011. Next one. Kripa joined her a few years later, and Kripa also, we developed a short program for the hospital, for the female health volunteers who were based in districts. And over 2 years, she traveled all over Surkhet district, giving fistula orientation to those health workers. And as you can see, it's not a question of sitting on the bus. She also had a baby on board. Her husband came often with her and did the baby carrying because they had all the other training materials and equipment to carry. So yeah, take my hat off to them. Those two really worked incredibly well and found us hundreds of patients before we opened the Fistula Centre. Next slide. So this is the lady who's now in charge of our outreach team, because after the Fistula Centre opened, we had too many empty beds, basically, because without the nurses going round, we were only relying on radio and we weren't finding people. So then we finally managed, after much negotiations, Kanti was appointed at the beginning of 2020 with her team. And you know what happened in 2020. And for a long time we were locked down, so it took a while to get going. I did a tour around the hospitals of the far west province, and this is where Kanti saw her first snow. Very exciting. So that's Kanti.